Okay, good evening, everybody. It's Rabbi Brag here, your camp director. We have here with us our camp doctor, Dr. Jeffrey Teitelbaum, who has been with us for many years, coming up for Shabbos in the summer, and been there for us throughout the whole year. Dr. Teitelbaum is a doctor in internal medicine and a pediatrician, and especially during this time, he's extremely busy, and he graciously agreed to give us about a half an hour. As you can see, he's in his office probably right now wearing his coat and giving us, an appointment, you would say, dealing with this. We have with us as well Shmuel Sashitsky, who is our EMT in camp, who will be relating the questions that we've gotten from many different people. Something to keep in mind is many of the questions, unfortunately, the medical field does not know at this point, as it's a new virus. And Dr. Teitelbaum still agreed to come on and give us a little background and stuff, what we can do, how to prevent it a little bit, health measures, what we can do. If you have any questions, you could send them on the bottom. You could put them in the chat and we will see them. If we have time, we'll get to them. If not, I'm sorry, I apologize, but we'll try the best. Dr. Teitelbaum, could you give us a few minutes exactly explaining what is COVID-19? What is this virus that's happening right now?
Sure. Coronaviruses are a group of viruses that the medical community has known about for many, many years. I've diagnosed coronaviruses in patients for many years. I could do a simple nasal test, and I do it all the time. And one of the tests that come out is coronavirus. However, this year, in a place in China called Wuhan, there was a novel, which means a brand new type of coronavirus. And it was detected. It was never, ever detected in human beings. And they called that the novel coronavirus 2019 strain. It was an animal strain, and the first time that it affected human beings. And since it affected human beings for the first time, therefore no human being has immunity to it. And since nobody has immunity to it, there's no vaccines that were ever created for it, and there's no medicines for it, and no person is naturally immune because they never had anything like it before. It causes, general coronaviruses in general cause mild disease like colds, and it could cause severe diseases like pneumonia. This novel coronavirus is predominantly doing the same thing in children, causing minor mild disease, but in certain susceptible people, it's causing an overwhelming type of pneumonia that's causing thickening and fibrosis of the lungs and causing people to have an acute respiratory distress syndrome. Similar viruses like this were in the past. There was something called SARS in the past. There was something called MERS in the past. And these are similar types of outbreaks of novel new viruses. Perhaps you've heard of other things like swine flu in 2009. But every time a new virus comes out that humans don't have immunity to, it affects them in a very intense way. This virus especially affects those people who are older. And older varies. The more older a person is, the more at risk they are. People over 70s, 80s, 90s, but people over 50s also are considered older. And people who have chronic conditions like diabetes, or if they have heart disease or lung disease, or other immunocompromising situations are all more susceptible. Young people tend to get milder cases and less severe. The pediatricians are not as busy as the internists are. The pediatric wards are not as busy as the adult internal medicine wards are. And that's what's happening. So I'm seeing a lot of people these days, and the people that I'm seeing range. A lot of people just have fever, they have colds, they have shaking chills, they're extremely ill, and Tylenol, and they get better. Then I have some people, and they vary in age, they're not always old, they're more the older people, more who have underlying conditions. All of a sudden, they just can't breathe. Every step they're taking, they're feeling short of breath. And when we check them with a simple test called the pulse oximeter, and we see that their oxygen is low, we know they have problems. Normal pulse oximeters range 95 to 100. These people are all less than 95 when they're having problems. If they're 90 to 95, they're having mild disease. If they're less than 90, They're having severe disease. And some of the major issues we're having is finding beds for these people. And that's what's happening. That's what's happening.
Well, I mean, definitely news to me that you said it's not the first time this happened. I thought that this is a new thing they discovered. You're saying you already diagnosed this.
This is a novel new virus that came at the end of 2019 in Wuhan, China. That's why it's called a new virus. But what I'm saying is that this new type of coronavirus belongs to a group of coronaviruses that we've seen in the past, but this is a new type. What I said in the past is we as human beings have had other outbreaks in our past with new viruses like this as well. There was a virus we called SARS about 18 years ago. There was a MERS about 10 years ago. There was swine flu, 2009. So humanity has seen novel viruses come from animal sources that become human viruses and affect human beings. And each time that this has happened, humans have been very susceptible and a lot of ill people from that. And that's why it hits us so difficult. But we've had new viruses in the past. This is not the first time we've had a new virus. Those other episodes were new viral episodes. SARS, MERS, swine flu, these are all episodes of new viruses entering. And eventually humanity becomes immune to it. And they become part of the natural things that will mutate over time. And we will become immune to it in years to come. And these viruses will stay with us and they will mutate and become different strains. And we're going to have to try to stay immune to them in years to come.
Thank you so much. Okay, Shmuel, our EMT. Shmuel, can you take us away with some of the questions that we have?
Yeah, okay. So I just want to remind everyone that if you have any questions or want something clarified, you could just send it into the chat box and we'll see it. No one else will see it, just us. So if you're worried about that. Okay, so let's start off first. So as if we all know, we're all stuck inside of this. We're trying to social distancing. That's the new hot button word everyone's using. Is there a problem for going outside? Should I be worried about going outside at all? Or is there a way to go outside that will still keep me protected?
People don't have to stay indoors within walls, okay? If you have a backyard, if you have a driveway, if you could go out, it's good to get some fresh air. It's good to exercise. You shouldn't stay locked into your room all day long trying to stay out of the sunshine and out of the air. No, you can go out, okay, but you should limit your social interactions. If you live on a house and you have 4 or 5 acres, you don't got to stay inside your house. You can go to your backyard. Even here in Brooklyn, people are going to their porches, they're going to their backyard, they're going up and down the driveways. If they have to limit where they have to go, they go where they have to go. But when you're going in the street, don't come within 6 feet of any other person, maybe 10, maybe more. Usually when one person talks to another, there's a certain amount of spray that comes out of their mouth. If I were to put a little paint in everybody's mouth and I would tell them just to talk, you'll see a little mist of color coming and creating a little mist in all the surfaces around and landing on the people in front of you for 6 feet. When you cough, maybe that spray goes 10 feet. When you sneeze, maybe it goes 10 feet. So therefore, it's important to stay in talking distance, not closer than 5 feet. If you're worried a person may sneeze, stay 10 feet away. So this past Shabbos, people are walking in Ocean Parkway. But when you walk in Ocean Parkway, as soon as you came near somebody, you saw this person went that way and that person went that way. Okay, so you can be outdoors. You just have to be socially distanced. We shouldn't gather in parks. We shouldn't gather, in backyards. But if we're not there to gather, you have to go somewhere, you got to do something. As long as the law allows you to do it, do what you're allowed to do within the parameters of the law and socially distance.
And how would you say the safe way to, someone needs to go to a store to get food or something like that? What is the proper way that what precautions should they take? Do they need to wear gloves when they go into the store? Do they need to wipe down the products that they buy before they bring it into the house? What about mail? Do they get delivery from somewhere? or takeout? Do they need to be worried about that?
Those are all excellent questions. There's no specific guidance. Everything, the virus can last on different surfaces or different lengths of time. Things like cardboard, it can last for an hour or two. Things like metal can last in some studies up to 2 to 3 days. Other surfaces like plastic could be somewhere in between those two. So generally, if you get something, you get a cardboard box, it's been out there, it should be okay. You don't know how how the UPS person put it down, but think about it. No matter what you're touching, okay, if it touches your hands from the cart that you are pushing in the supermarket or from any package, how is it going to get inside your body? It's not going through your hands. It's not going through your hands. It's going to go from your hands to your face. If you bring it to your face, then you're at risk, okay? So if you wear a pair of gloves when you're touching everything and then your glove touches your face, you accomplish nothing. So it's not a matter of the object. When you have a human being, they could spray it upon you. They can talk to you and spray you. They can cough and sneeze upon you. But if you're talking about an object that you're touching that has corona on it, I'm sorry, I'm getting called by the answering service. If you're touching an object that has corona, but you wash your hands afterwards, it's not going to affect you. It doesn't go through your hands.
Got it. So how come there are people saying that masks are either not necessary or don't work at all?
The question, listen, we're not going to sit here and try to figure out why certain people say certain things. There's a lot of different things going on out there, and we're not here to defend everything that people say. So you have to find out what your sources are. You should go ahead and only read credible sources. The only thing you should read is the recommendations. If you live in New York City, the New York City Department of Health. If you live outside New York City in New York State, then you should read the New York State Department of Health recommendations. And if you live anywhere else, you should follow your local health department's regulations. You should not be following what social media is telling you and what people say. That's non-verifiable, and medical professionals are too busy to sit around and try to understand why everybody says what they're saying.
100%. So do you believe a mask is an appropriate measure for people to take? Or should we say them for the...
Masks help you in certain circumstances. If you wear a mask a whole day and you are assuming that the people around you are giving you coronavirus, then the second you're touching that mask on the outside of that mask, your hands are contaminated. You would have to then wash your hands. If you took your mask and put it down underneath your chin, now your whole face is smeared with whatever is on the outside of your mask. So at that point, you would have to take your mask and throw it out. So a mask should be used for an interaction with somebody that you are at risk for. And if you think that you've been at risk because you were in contact with somebody who could have sprayed you, just remember, the outside of the mask is contaminated. So if you put it up your head, down your head, or touch it, it's infected. So no, people should not be wearing masks an entire day if they're healthy and around just the general population. I, as a doctor, I will wear a mask because I talk to people. And if I talk to people, maybe I'm going to spray them. And therefore, to protect my patients, I will wear a mask. If my patients are near me, I will protect myself from their spray by wearing a mask. And then when I finish, I take off the mask, put it in the garbage, and wash my hands. If I wear the mask an entire day, that mask, the second I move it away from its position, is contaminating my hands or my body. So I am putting away the benefit that I get. They should be used for short periods of time when you are at risk and then discarded. If you wear a pair of gloves the whole day, you accomplish nothing because whatever you're in contact with, you're touching. Whatever you're touching is getting the gloves. So if you think that you're protecting yourself against coronavirus, that means you have coronavirus. You've been exposed. Now your gloves have it. Whatever you touched is now infected. So what are you going to do? You can't eat while wearing it. So no, you shouldn't wear gloves the whole day. You shouldn't wear a mask the whole day. If you have a certain situation where you're coming in contact more high risk, you could wear it during that time and then remove it.
Okay, thank you. So now I'm gonna move on to a little different topic. If I know somebody who was with someone who was actually diagnosed with the virus, do I consider myself as if I was exposed to the virus, and do I need to quarantine myself from everybody else?
Everything depends on where you live. Okay, so the rule I'm going to say now is going to be for the location I say. Okay, at the beginning of this viral pandemic, when it was not widespread, it was just a few people who had it, and the government officials were trying to isolate those people so it shouldn't spread. There was one type of rule that I'm going to say. Once it has spread so widely in different locations, then different rules go to effect. So in the beginning of the illness, in the beginning of the spread, around us, would be, let's say, before Purim, okay, at that time when it wasn't widespread, the New York State Department of Health, the way we're dealing with the New York State, was based on the CDC guidelines that if anybody was found to have it, then anybody who came in close contact with that person would have to quarantine themselves for 14 days. That means they're perfectly healthy, but they came in contact with somebody that had it. They would then have to lock themselves away for 14 days to see if they would come out with symptoms. And if they didn't have symptoms, they can then come out. The person who had the illness had to follow their criteria for being locked up. That was called isolation. But the healthy people were quarantined. So ill people were isolated. Healthy people were quarantined to see if they would come out in 14 days. That is what's still being done in parts of New York State and parts of the country. New York City is very different. New York City is considered that every single person already is exposed. And if every single person is exposed, then if somebody has the illness, that person is isolated, locked up for 7 days, for sure, for the first time they have symptoms, till they are feeling well after 7 days for at least 3 days. Meaning, let's say they got sick on a Friday, they have to stay locked up for 7 days till the next Friday, and they have to be feeling well for 3 days. At that point, that isolated person can re-enter the world. Anybody else who came in contact with that person, even if it's a household member, can go about their regular life in New York City. Because there's never a time that anybody in New York City could feel that they're not at risk. Every single person in New York City is exposed every single day. And if we quarantined New York City residents for 14 days, the moment they would come out, they have to be quarantined again because everybody has it. So therefore, New York City, if somebody's ill, they're isolated for 7 days. And if for 7 days they're isolated and 3 days they're well, they can come out. But all their contacts, including their household members, can go about their regular routine. And they should all self-monitor themselves with temperatures. And if they develop symptoms, then they go into isolation. So outside of New York City, there is a quarantine for people who are exposed to a case. In New York City, there is no quarantine for healthy people exposed to ill people.
Got it. So at what point do I consider myself symptoms? What are the exact symptoms that I need to now isolate in New York City specifically, and in general? And included in that, there's many people are talking about the taste and smell, the loss of taste and smell. It's not on the official CDC website as a symptom, but there have been a lot of stories of people saying that they've lost the taste and smell and then have been diagnosed. So is that something enough for me to say that I have it and now I need to lock myself up?
The New York City Department of Health and the state government, they are right now considering whether to include those as additional markers of disease, okay? Certainly if somebody has fever, certainly if they have cough, if they have body aches, if they have shortness of breath, those are clear. Those people have it. And in New York City, we do not even test people. It's recommended at this time not to test anybody. Everybody is presumed to have it, which creates a whole set of problems that you won't discuss, but maybe they have something else and maybe they are not being diagnosed properly. Maybe they're missing other things. But everybody in New York City, nobody's being tested. They don't allow the tests unless there's a good reason. Everybody's presumed to have it. There are additional tests that are not, there are additional symptoms that are not classic. 20 to 30% of patients are presenting with diarrhea. Okay, there's a lot of talk about not being able to smell or taste as a good marker of it, but it's not diagnostic by itself. We have some people who just can't go ahead and smell and taste, and that has not been defined by New York City as Department of Health as a sign of COVID. So COVID-19 is fever with the cough, with the body aches, the shortness of breath, with sore throat. It can have diarrhea. It can have the lack of smell and taste. And all these, by a physician, have to be taken into consideration. But it could be all of them, none of them, some of them, and different providers are trying to figure it out. In places where they use testing, the testing helps define it. But testing is not perfect because you could have a false negative and it could still be COVID. You could have a positive test and maybe the person's over it. So testing is not recommended in New York City. It's still used in other parts of the state and other states. But it's a challenge. It's a challenge to say if a person has it sometimes or not, if they have these mild symptoms. Sometimes you have to tell somebody to isolate themselves for 7 days out of a doubt. We're people that are used to wanting to be sure of everything. We want to be how do I know for sure? You're telling me to lock myself up for 7 days. How do I know? And we're in a state right now where we're in a state of affairs where we don't know. And we're just trying to follow guidelines as best as possible. And sometimes people are making mistakes, but we just have to follow guidelines. That's what we're doing right now.
Okay, you mentioned fever. What temperature is considered fever?
For a regular person, above 100.4. For healthcare workers, they're considering 100.0.
Okay, thank you. Okay, is there any ways that I can make myself healthier to boost my immune system to help me fight this specific virus?
Yes, yes. You should sleep, okay? Get sleep. You should have a positive mindset. If people are home all day long, worried and nervous, that's going to depress your immune system. You should eat properly. Don't overeat because you're home, okay? Eat healthy foods. You should exercise. You should exercise. You should get a walk, a jog. Just exercise and keep your body fit. Because if a person does get an illness and they're not fit, it's a greater strain on their body. You should practice good hygiene and good social distancing.
Okay, and once someone has this, they're considered immune and they go out and they're totally fine?
Nobody knows. Nobody knows. It's possible, but nobody knows for sure. And there is no definition because they do not have a serological test to confirm immunity. And they're trying to figure out if there's one strain going on or multiple strains. We don't really know. It's only going on for about a week and a half in New York City that the hospitals are getting all these patients, and they're starting to do genetic tests on all these strains. So first thing to find out how many strains there are out there, and nobody knows. Technically speaking, if somebody thinks they had it, and then a week or two later, they would have other symptoms, and we're starting to see people like that, we quarantine or isolate them again. So therefore, no, we don't consider people to say, but I had it already, so now I can do everything I want, and in case I get sick again, I don't have to go through these procedures. We are not working with that assumption. We are working with the assumption that people will be isolated again, and it's possible for them to get it again, even though that might not be true. We hope that we'll have answers in the weeks to come to clarify that. But there is no current answer, but that's how we are doing things.
Okay. Many times we hear that the we're trying to flatten the curve to prevent an overrun of the hospital so that they can actually take care of the patients and not have too many people there. If we keep hearing that many of the patients that are higher risk, meaning older than 50 or 60, patients with different chronic conditions and things like that, if that's true, then why can't the younger people go out and stay away from those older people? Or can a younger person also get really sick?
There are definitely younger people who are getting sick. I had a patient yesterday who was 37 years old and had an O2 saturation of 85%. So younger people are also getting sick. There are some neighborhoods where the local physicians have thought it best to let it burn out in their communities. And therefore, everybody will become immune. And there are some communities where it has taken such a strong hold that the numbers are starting perhaps even to go down of cases in those areas. When that proposal was given to the Department of Health officials to let that happen so that it could spread across and that everybody could become immune, nobody will take the responsibility of letting that happen, because any casualty that happens is the responsibility of those people. So therefore, that is not the decision of public health. If people just wanted to knock out all the old people, then they would go ahead and do it. But since every life is precious and young people do have it as well, to make that sort of public health decision, a person would have to say they're taking achrayus for every death that happens, and nobody will take that achrayus. Nobody will go ahead and take that responsibility. And therefore, the recommendation is to save as many people as possible. And this is the best way. If we go ahead and flatten the curve, maybe a medication can be found, and each hospital is doing trials to try to see which medications will work. Maybe a vaccine could be developed. If we delay as much as possible, we might get time to have a medication or a vaccine become available. And nobody will take responsibility of any death.
So at the moment, it's true to say that there's no medications or treatments for the virus itself specifically, just regular care of the patient.
There are experimental protocols that are being done. I myself am prescribing medications for people that have moderate disease that almost have to enter the hospital. We are using as outpatients certain protocols that the hospitals are using. The hospitals are using experimental protocols that they've learned from China and from other countries. But they have no proof, according to the American standards, which are much more rigorous, that these actually work. And the studies from China and France are not considered conclusive, and they're not considered trustworthy. And therefore, they're all being tried in the current epidemic in different hospitals. Each hospital is using different regimens, and they're trying to control in a reliable way to find out what's working. Some doctors are using medications, but nothing has been proven to work. There are regimens that we're using, but nothing is proven.
Okay. Specifically in New York State, they're talking, Governor Cuomo has been mentioning respirators as one of the points of bottleneck in the hospitals. What exactly is a respirator, and why is there a shortage? Why can't they just make more?
Respirators are highly advanced machines that help people breathe. They're high-tech machines, they're expensive, and there's just only a certain amount of machines, and there's only a certain amount of units that could handle it. Even if you have a lot of machines, but if you don't have enough respiratory technicians, and you don't have nurses or doctors who can manage these machines, having them won't help anybody. Just yesterday in one hospital in Queens, 13 people died, okay? How could that happen? Even if you had all the machines in the world, it's not gonna help you if you don't have enough people watching them. So it's not, just having the machines won't help if you don't have enough people watching these machines. What we're trying to do is we are trying, local chesed agencies right now, including Hatzalah, sometimes is saying it's better off for a mild patient to stay home. I've had some mild patients with O2 saturations about 93, 94%. That normally would go to a hospital. In this situation, trying to keep them home, getting something called an oxygen concentrator, which is a home device that increases some oxygen to people, and giving them a pulse oximeter. And we're keeping some of these people home because we're worried that if we send them to emergency rooms and they're not well enough staffed, they can die waiting for staff in the emergency room. And that's what happened in Europe and in Italy. And so if we don't have to send them in, we're trying to see if we can keep them home. Once their O2 sat drops to less than 90, then the machines that some people get their hands on at home won't help them in those situations anyway. We send them in regardless.
So Pesach is coming up, and many people plan to go to hotels or family or have their grandmother come. What should people do? Should they cancel their plans and stay home? Should they invite people to their house? Or
I don't know of any hotels that are opened. I think they all closed, as far as I know. Maybe there are some that are still open. I don't know how they're doing it. Almost every one that I'm aware of, I know a lot of people who own them. I know a lot of people who go to them, and they're all closed. I don't think anybody's planning on a hotel. It could be a catastrophe. If you have older people who go, they're not going. And younger people generally aren't. People are avoiding gathering on Pesach. Almost people who are calling me, I'm saying don't gather. We're seeing a lot of young families making Pesach for the first time themselves. Older people are not joining their children. There is some talk that if people started a week ago beforehand to totally quarantine themselves for 14 days, nobody goes into the house, nobody goes out of the house, no cleaning help, nobody goes shopping, nothing. If family is totally isolated for 14 days and the grandparent is, and from going to place A to place B, there's no contact with people, and during those 14 days, nobody got sick even once, there is a possibility of saying they could join each other. But those conditions are so difficult to go ahead and guarantee that if it wasn't done by today, there's no way to do it because you need 14 days to do it. So if people didn't make the plans last week and started already, there's no way from today they could, because 14 days from now already is Erev Pesach.
Got it. Okay, so just to reiterate,
so there will be people doing Pesach alone. Young couples who never made it will be making it themselves. Older people who usually have grandchildren will not be having it. Okay, there is a risk. And nobody could say it's okay unless they quarantined themselves totally, which is very difficult to do. If they did totally quarantine themselves for 14 days, both sides, and like I said, it's so difficult to do, theoretically it should be okay. But each person should ask their provider. The grandparents or older or more sensitive people should ask their provider if they're allowed to do it. That's not something that we give the permission here. It's a theoretical possibility.
All right, and totally isolated means like not even going to the store to get food.
You can't go to the pharmacy to get your essentials. You can't go to the supermarket. That would break the quarantine.
Okay. Talking about the stores for a second, we see that they stopped minyanim, and originally the rule was over 50 people together. Some places had 10, but what is the difference between having 50 people in one place as opposed to 200? Isn't that going to spread it anyway?
Right now, there is no 50 anymore. That was, as of this past Friday, 1 week ago, last Friday, they already did not allow 50. No gatherings of any kind are allowed. 50 was what they were trying to limit it till last Friday in New York City. As of last Saturday, they did not allow the 50 anymore. There's no 50 rule anymore. Any gathering of any size is considered illegal.
Right. So that's the question. What was the original thinking for 50? What does 50 help?
It was mitigating. At that point, they were trying to mitigate. That means that a little better is better than nothing. and they were trying to mitigate. Mitigate means decrease the risk, but not. They felt something is better than nothing. That was the number that was chosen.
Okay.
But today they're not even allowing 50.
Okay. So we're gonna look at some
I'll
of the
give you an
questions.
example. I'll give you an example. Okay. My son was supposed to get married today. And last Friday, we thought we could gather 50 people. We were counting the family members. Last Saturday night in New York City, I saw that they abolished the rule. We could not have 50 people. You can't even have 10 people, okay, as of Sunday, 8 p.m. in New York City. So on Saturday night, we decided that we have to make the wedding before Sunday night, 8 p.m. So at 10 p.m. New York City time, on Saturday night, we said we have to make a wedding in the next 12 hours. So we just gathered, and we had maybe 15 men, okay, and made a wedding, a chuppah, in the driveway. Because if it would have been past 8 p.m. on Sunday, at that point, no gathering would be allowed, not even 10 people. And if you have 10 men with one collar, that's 11 already. So we went ahead and made a wedding on Sunday, because today we wouldn't have been able to have it.
Wow.
That was a zone counselor from years ago.
Yeah, I was supposed to be there. Yeah, I had a notification on my phone today about the wedding. Yeah.
So it really affects a lot of people. There were a lot of weddings in New York City that Sunday because that was the last day that you'd be able to have any gathering of any kind.
Okay. So if everyone in New York is considered to be already exposed, why are we still trying to keep apart from everyone?
You're exposed and you don't know when you're going to come down with it. You're exposed. Everybody's exposed. So, but we don't know who's going to come down with it. And everybody is exposed to different degrees. If I'm next to somebody who's very sick, on the day that he's very sick, he's very contagious. On other days, he's mildly contagious. So everybody's considered exposed, and I could come down with it any single day. It doesn't pay to quarantine. The whole point of quarantining is trying to isolate the virus. We're not able to isolate it. It's so widespread. It's futile.
I understand. Okay. About the medications that you mentioned.
By the way, if you live upstate New York, okay, where Ura is right now, I don't think they're having that many cases over there. So if one case would be over there, then that person who had it would have to be locked up, isolated. Whoever came in contact with them would have to quarantine for 14 days because they're trying to make sure it doesn't spread out of that contained area. But here in New York, it's so widespread, quarantine won't help the spread. The spread already is out there. Everybody should just monitor themselves for their health. If they develop symptoms, then isolate themselves.
Okay. There've been reports that men are more affected than women. Is that accurate? Or
the data seems to corroborate that. Almost every single patient that I have is male, and whatever spouses that I see, it's usually the husbands. The wives are bringing the husbands. It seems to be that seems to be the data right now.
So does that mean that if we have to go out to get food, for example, should the wife go as opposed to the husband?
There's no recommendations about that. Everybody should do the best that they can. There's no recommendations about it. It's a very good question. I could ask the health departments. I don't want to make my own recommendation about it. It's a very good question.
Okay. If anyone has any questions, just to remind you that you can send it into the chat. We're getting a few of them over there.
By the way, I just want to say that everything that's happening is changing every single day. So the advice that I gave people 2 weeks ago is different advice I gave 1 week ago. And the advice I'm giving today might be different in a few days. Sometimes the advice changes from morning to night. So everything that we're saying is for this time only. and things may change. And things are definitely going to change because the whole situation is evolving.
Okay, so we've heard in many press conferences, they talk about a drug for malaria called chloroquine or hydroxychloroquine. We understand that right now there's no official treatments and that it's under trial, but what does a trial mean exactly, and how long can something like that take?
We're doing I'm using hydroxychloroquine right now on patients who meet certain criteria. If they meet those criteria, then I prescribe the hydroxychloroquine. A number of doctors are able to do it. You have to be part of a study group to be able to do it. Until this week, in New York State, all pharmacies were allowed to give it out. The governor did not change the law this week, and you cannot get it at all pharmacies. The pharmacies are not allowed to dispense it unless the doctors prescribing it are part of a study group, trying to get the data to see if it works. It worked in China. It was supposedly helpful in China and other countries. The United States is skeptical if it's working. And there's different dosages and different regimens being given in different hospitals. Some hospitals are using 600 twice a day. Some are using 400 twice a day. Some people are using 200 twice a day. Some people are using it for this many days. Some are using it for that many days. So many different ways of using it with so many different other drugs, with Zithromax, with famotidine, with oxycycline, with other drugs. Nobody knows for sure what's working. They're trying to do different dosages in different hospitals and comparing the effectiveness and getting American data with American rigorous standards to see if there is a benefit on it or not.
Okay, so right now,
it could take weeks to know. Right now, nobody knows. They're trying.
That's right. And this is a medication that's been around for a while. We already know the side effects of it. It's deemed relatively safe.
No, it's used and it has a lot of side effects. It could affect the heart rhythm. And when it's used with other drugs that also affect the heart rhythm, there's a lot of people that we are afraid to use it on because they might die from using the drug.
Okay, so it goes to say do not self-medicate even if you have that medication in your house.
No.
Or some other condition.
No. There's a number of patients that before I used it, I asked the cardiologist, I asked their other specialists. I've taken EKGs on people and made sure that they're fine before I give it to them. It is dangerous to use it without direction of a physician.
Okay. And somebody that has been contagious, I think we said this already once, but some people are asking it, so I'll ask again. After someone is diagnosed with the virus, for how long are they considered contagious?
New York City, at least for 7 days once they've had the onset of symptoms, for 7 days, and they also have to be feeling better for 3 days. So 7 days from the onset, and they have to be feeling better for 3 days before they could go back. So if somebody today develops symptoms on Thursday, next Thursday morning, if they were feeling better for 3 days already, then they could go out of quarantine. If they're not feeling better, they'd have to wait till they're past the 7 days and then wait 3 days of feeling better.
Okay, so total of 10 altogether.
No, it could be 7. If they're feeling better by day 4, then day 5, 6, and 7 would count as feeling well and completing 7 days. So it's possible 7 days or 7 plus whatever it takes to be well for 3 days.
Got it. Can you just give us a little clarity on understanding how exactly the flattening the curve is saving people's lives?
It's quite simple. If the hospital has so many patients in the emergency room that they don't have enough doctors to take care of them and enough rooms to be seen, they can die in the waiting room waiting to get attention.
So that means to say that even someone who's young and healthy, because they can't get the care that they would otherwise be fine from the virus, therefore they can also die from it.
If they would be the only person in the hospital, they would have gotten the care they need to live. But since there's so many people and the doctors can't get to each person and they don't have enough supplies for each person, they're dying because they can't get the care. If they would be the only person in the hospital and have all the doctor's attention, they would have lived.
Right.
So flattening the curve means that you get attention.
And that means that if there's a car accident or something, then that patient can also, who might have survived, but now that the hospital is overrun, they're included and just not enough.
That's right.
Okay, there's one question I don't understand, and maybe you could explain. Someone asks if you can explain what it means to strengthen respiratory hygiene. I don't know what that means exactly, but
hygiene is hygiene. You got to keep your cleanliness. I don't know what I'm not exactly sure I understand.
Okay.
You shouldn't be breathing.
The person that sent that in, if you can just clarify, maybe.
I think social distancing will just make sure that you're not breathing on top of each other. I'm not exactly sure what the phrase is.
Okay, and if let's say somebody is smokes or something like that, is this or is overweight? Is that considered being at risk for more severe repercussions from this?
There's a lot of factors. Everything depends on HaKadosh Baruch Hu, okay? And we could see some people who have all the risk factors in the world and have nothing. And we could see people who have no risk factors and all of a sudden have terrible disease. Risk factors is a way of what people do to minimize their risks, okay? So people tell me, but so-and-so smokes and eats, they live to be 120. And somebody watches himself, he's a marathon runner and he's a vegetarian, and somehow he died at 19. We believe there's HaKadosh Baruch Hu, but HaKadosh Baruch Hu tells us we have to do hishtadlus. We have to go ahead and do what we need to do. Having these risk factors, anything that affects your lungs, smoking, being overweight, that all makes breathing harder. Potentially those people will have more of a risk. And I definitely see that people who have some difficulty with breathing, all of a sudden that they're given a challenge to the breathing system, to the respiratory system, they will already be at a challenged point. So people should be as healthy as possible to give their bodies the best chance to fight off the respiratory challenge. If a person's overweight, they already are having difficulty breathing. And now you add something to it, it could potentiate. If somebody's an asthmatic, somebody's vapes, if somebody smokes, they're affecting themselves in a way that could lead to a more riskier situation.
Okay, so stopping to smoke today will help me in the future, probably.
In this and in all episodes, in all different challenges in life, yes.
So this is a good incentive to use.
If this is what you need, that's what you need, but there's other benefits as well, yes. For the meantime, don't smoke, don't vape, take care of yourself, go out for a run, do some calisthenics, do some jumping jacks, jump rope if you only have a porch to be on. Just do some exercise, get short of breath when you're doing your jumping jacks and your jumping rope and you're jogging in place or jogging up and down your driveway, and be healthy. Don't be overweight. Take care of any respiratory challenge you have so it shouldn't become additive to any condition you have.
Okay, we have our last question. If anyone has anything, last chance. So we're looking forward to the warmer months now. And people say that as just like the flu vaccine, the flu season we have every year sort of peters out towards the warmer months. Is there hope that maybe this would sort of die out towards the summer as the weather warms up? And there have been people talking about using blow dryers to help kill the virus. If you could talk about that as well.
There's no recommendations from any Department of Health to use blow dryers or to use suntan machines or anything like that. So I'm not aware of any credible recommendations for that. What will be in 2 months from now? I don't know what's going to be in a week from now. I think we have to stay positive. I think we need to, trust in HaKadosh Baruch Hu that things will get better, and we have to do what we can to keep people safe right now. But I don't think anybody really has, any knowledge. Nobody knows what's going to be tomorrow. Nobody knows what's going to be next week. And I don't think anybody's giving recommendations and predictions. What I could say is that this is not the first time that humanity has faced such a challenge. We've never been challenged in this sort of of a generation with everything that we have, but we've been challenged in the past. And if you look at the history of all epidemics in the past, they come and they go. I can't say that we won't have this go without being unscathed. There have been, losses, and there have been, tragedies, and halavai, we should come through it without any more. But as we speak, there are people struggling right now for their lives. But I'm certain that at some point this will pass. And we have to do our part now every single moment to contain it as much as possible, to protect ourselves, protect our elderly, protect those at risk. And with our efforts, HaKadosh Baruch Hu's siyata d'shmaya, I'm confident that at some point we'll come through it.
Okay. So a few people sent in now that they got the last chance warning. So just we'll go through them quickly here. So many people are having a hard time comparing, shul and school to going to the store. Can you explain why having a minyan of only 10 people with the proper social distancing guidelines is still a problem, but me going to get food from the store is not?
The longer you spend with somebody in face-to-face contact in a contained area, the greater the risk. When you go ahead and you pass somebody in the street, you're passing them for 1 second. When you go ahead and you sit with somebody, chavrusa style or davening right next to them, in front of them, the longer you're staying, the longer you have contact with them. So it's a prolonged period of time that you are gathered together. It's very different than passing somebody for a short period of time.
Okay. Someone wants to know, can we assume that schools will be open after Pesach, or is that something we can answer at the moment?
Every community is going to have to see what's doing by then. It's hard to say. No two areas are the same. Hard to say. I don't have that. I don't know. I can't answer that question.
So at the moment, we just have no answer. Okay.
Stay tuned.
Stay tuned. And okay, this has been asked a few times. We did cover this, but if you can reiterate just quickly about Pesach. If someone already had the virus, so at the moment we don't consider them immune, and therefore if someone gets it again, we have to re-isolate. But if they had it already, can they now get together for Pesach or no?
The recommendations are no.
Okay.
Until there are tests of immunity, we don't know who's immune. Just because somebody has it, they thought they had, we mentioned this question before, maybe there's different strains. Maybe they had a mild case and they didn't have a full case. The answer is no. Okay, we cannot assume that we had it, we're done, until we have proof of that. Right now, there is no proof in the medical societies to prove that. Everybody who does it is taking their own risk. Nobody's going to tell people what to do, but if you ask for a recommendation is no.
Okay. And no minyanim, no outdoor minyanim, nothing.
No. When you start going ahead, you know what? This past Shabbos was my son's Ufruf. I had an ability to have a Sefer Torah in my house with 10 people, and I could have done it with my own family. I didn't do it. This Shabbos is my son's Shabbat Chatan, okay? And I could get 10 people easily with a Sefer Torah just with my own family. I'm not doing it. The reason I'm not doing it is because even if I think I know how to do it in a smart way, somebody is going to go ahead and see what's being done and do it in a not smart way. So even if you follow the best sort of protocols, somebody's going to look and say, well, if he could do it, why can I do it? And before you know it, people don't know what they're doing, and it becomes a dangerous situation. And therefore, even though you have great Rabbanim who we could arrange that they could do a minyan and be very far away from the next person, do you really know 100% you're going to be careful? It's possible somebody's not going to do it. And therefore, we don't try to go to the edge of what I could do and try to get away with it. If you're on a highway and you say, you know what, it says that I could travel this many miles per hour and I'm going to go right by the edge. You could fall off. We have to go ahead and establish guidelines that the general population is going to be able to follow across, and not try to outsmart the system and then fall down and get hurt somebody else, and cause other people to see what we're doing and they should stumble. It is a law. It's Dina de Machusa Dina, and you have to follow. You have to ask your rabbis. If the government tells you that you're not allowed to do it and you went ahead and did it, you're going to have to ask, and I don't have to answer, I'm not a rabbi, if those brachas are brachas, if those tefillos are considered tefillos. I don't have to answer such questions. Rabbis will have to answer that. And it seems they have answered that. There's so many letters of rabbis who said not to do it. And if they said not to do it, then who are we to try to be more than them?
Okay. Well, thank you very much. If anyone's, a lot of people asked about camp. We're going to talk about camp after this is over.
I thought this was going to be a half an hour meeting. It's now an hour. I have patients calling me and I have to go.
Okay,
Yes, thank you very much.
Dr. Teitelbaum, we really, really appreciate your time. Unbelievable. Should only see Yeshua's in the force for whole class. So.
Amen. Good luck, everybody. Okay, daven. Everybody should daven.
Amen.
Take care.
Rog, a lot of people asked about the summer camp. If you could just answer that.
Yeah, just quickly about camp. Obviously, at this point, like you just heard, it's in the medical field, it's unknown. So by us, it's for sure unknown. As it stands right now, we are having camp. If your tormentor people ask you if there's camp and should they sign up, the answer is they should sign up and reserve a spot. Obviously, if it's not safe, deemed safe for us to open up, then we will not open camp and people will get full refunds. Baruch Hashem, as of today, I saw that someone sent around that in Schoharie County, there's only 2 cases. So let's hope it stays that way, and that's the first place that could open up and we're all safe to go there. I don't know if it's going to help if everyone was, maybe we'll tell everyone to go into quarantine for 3 weeks, everyone will come into camp. But the ikr is everyone should keep on davening and stay safe. And Rabbi Levitin put together to keep everybody on here is that there's interviews for session B is starting. We're going to do them via Zoom. Sorry, we can't have, I mean, you never know, maybe you have to pay some way to have a reunion. But the way it stands is we'll start with interviews now because people want to take interviews, people want to get in, and we want to give people spots in camp. And we can't thank Shmuel enough. Shmuel, thank you so much. You did a perfect job giving all the questions very clearly. And thank you so much. Taka b'yischos for everybody and refuah for everybody. We should only hear good news. Guys, reach out to your campers, reach out to your torments. I'm telling you, they're so bored. They go, you think you're bored? They're double bored. They've been out of school and out of thing way before us. They're going nuts. So reach out, whatever you're going to do. Okay, special activity coming up next week. Who wants to be a zone millionaire? Look out, virtual. And maybe we should do one for the staff. I like that idea. Maybe we'll consider that. Okay, thank you so much, guys. Have a good Shabbos.